This is to discuss how you take care of your plaster or dressings after you've had your foot or ankle surgery. You will go home from the hospital, and when you go home, as like as not, you'll be on crutches. Now, we will tell you whether you can weight bear. So the nurses will very clearly enunciate the type of weight bearing status that you have before you go home. Now, when you go home, your priorities are to rest, not to go to work, and also to put your foot up. Now, your foot needs to be slightly above your bottom, because as you can imagine, water runs downhill. And whilst that's a very simple concept, it's important not to have your foot down, because then the fluid will collect in your foot. And this has an effect on your wound healing. Now, the wound itself needs to be protected for a few days at least, and that's why we put dressings on the outside. If we put you in a plaster to immobilise the area, which we often do after a stabilisation, for instance, or after a bone fusion, then we'll leave that plaster on until we see you, usually about 10 days to 2 weeks after the surgery. You need to keep it dry, and so when you're having a shower, pull a plastic bag over the top, put some tape around it so it's sealed, and then you can have a normal shower. If it gets a little bit wet, it's no great issue. Just take it off and use a hairdryer or something similar to dry it out. Now, if there is no plaster, we'll often say that you can take your dressing off, say 3 days after the surgery, and usually there will be a sticky dressing underneath the outer dressing. So once the outer dressing is removed, there will be some little band-aid-like structures which you can usually see through. These will make it waterproof, and this will enable you to have a shower. Now, usually, if you don't have a plaster put on, you'll either have a special shoe, which we will give you, and which will go home with you, or you will have a boot, one of the two. And we'll give you instructions as to how to manage these, and we'll also tell you whether you can weight bear or not. But once again, the key issue is to rest, elevate the foot so that water runs downhill, and have a quiet time.